Welcome to this in-service tutorial for Aeron Corporation's MACS CPAP system. The Aeron MACS, which stands for MACS CPAP system, provides EMS agencies superior cost-effective CPAP, continuous positive airway pressure, as critical care respiratory support for the spontaneously breathing patient. As a manufacturer of critical care ventilators, Aeron has focused on making the CPAP system an integral feature in their original hospital ventilator, the Newton Model A, as well as their Newton Model S designed for EMS. The MACS CPAP system is built with the same demand valve technology. MACS is ideal for pediatric and adult patients in respiratory distress, including congestive heart failure, asthma, COPD, or for any patient with severe breathing difficulty, many of whom would otherwise require intubation. In fact, EMS agencies with MACS CPAP protocols have reported a substantial decrease in patient intubations with increased emergency room stabilization. Weighing just 3 pounds, this small, portable, easy-to-use CPAP device is ideal for use in the field, during transport either ground or air, and in the ER, as well as other critical care settings in the hospital. Though small and lightweight, MACS is built tough to stand up to even the most challenging EMS in-field rigor. MACS is rugged enough to withstand the tests required for the U.S. Army Airworthiness Certification, the harshest tests for any product. The MACS CPAP system has 5 key advantages that make it a must for EMS, transport, and the emergency department. First, Aeron's MACS is the only CPAP mask that offers true CPAP with low work of breathing, automatic sensitivity, peak flow up to 140 liters flow rate for the spontaneously breathing patient, and patient support via a face mask or an endotracheal tube. A calibrated knob sets the desired CPAP level with accuracy to the number. There are no extra valves needed or treatment limits to valve positioning. Further, the device uses efficient demand flow technology with automatic flow triggering. This enables superior CPAP delivery without wasting oxygen while maintaining CPAP pressure. Also, MACS provides the option of 65 or 100% oxygen delivery to match patient effort and oxygen needs. MACS has the lowest oxygen consumption of any CPAP device, with a 45-minute runtime on a D cylinder. And with the lowest cost proprietary patient breathing circuit, you are always assured of proper function and can add an expiratory filter to protect your staff. What's more, a low-profile mask reduces facial pressure to provide a more comfortable patient experience. Let's start our product in service. We'll begin at the unit's rear panel and look at 2 specific features: driving gas input, air intake and filter. On the far right of the back panel is the driving gas input connection. Keep in mind the Aeron MACS CPAP system does not require electricity or batteries for operation. Similar to other CPAP devices used in EMS, the MACS runs on a high-flow oxygen source or portable compressed oxygen cylinder and requires 55 psi with a minimum flow of 40 liters per minute. Always ensure that the gas supply line is secure and operating at the proper pressure. Note that when the gas is first connected and flowing, the CPAP system will begin to function at the preset values. Air intake and filter. To the left of the driving gas input is the air intake and filter for the ambient air entrainment feature. Inside the device, ambient air is entrained for gas mixing and delivery of the oxygen level that is actually needed for your patient. Aeron Corporation will change the air filter during routine preventative maintenance, which is required every 2 years. The filter can also be fitted with a nuclear bacterial chemical filter, also known as an NBC filter, for use in hazmat situations. Now let's move our attention to the front panel of the MACS CPAP system. First, you will note at the top of the front panel is a large pressure gauge or manometer that gives a visual indicator of the CPAP pressure with an indication of the patient's effort and respiratory rate. This gauge has an added advantage of glow-in-the-dark graphics, so it can be easily read in low light or nighttime situations. Now let's review the control parameters related to patient respiratory support. CPAP control, percent oxygen control, and the patient circuit connection. CPAP control. Below the manometer to the left is the CPAP control. Using a calibrated CPAP control to set the desired level, dial in the CPAP by turning the knob clockwise, which adjusts up to 20 centimeters of water pressure. No extra valves needed. The MACS is a demand flow device providing automatic sensitivity for changing patient needs, with a maximum flow rate up to 140 liters per minute. Please note that it takes less than 1.5 centimeters to open the demand valve, a key advantage with any patient working hard to breathe. The MACS will make it as sensitive as possible when the patient starts initial effort of breathing. The device opens the demand valve, and the flow will adjust automatically breath to breath to meet patient demand, which assures proper pressure delivery without wasting oxygen. When the EMT or paramedic is starting a patient on CPAP, they often start at 5 centimeters of water and slowly move up to 10 centimeters of water so the patient is not overwhelmed. As you will see while using the MACS, the CPAP system is very responsive with low work of breathing, similar to critical care ventilators within the ICU. To shut the device off, turn the knob all the way to the left at the 0 position. Percent oxygen control. To the right of the CPAP control is the percent oxygen control. MACS allows the choice between either 65 or 100% oxygen, providing only the oxygen level to meet your patient's requirements. MACS has the lowest oxygen consumption of any CPAP device. When using the 65% setting, a D cylinder will allow for a 45-minute runtime, providing you with the time you need during transport. Patient circuit connections. Below the percent oxygen control are the patient circuit connections. Right-hand connection is for the 22mm hose of the patient circuit, which will deliver the CPAP level and demand flow to the patient. Left-hand connection is for the small bore tubing, which connects the exhalation valve on the patient circuit and maintains the accuracy of the delivered CPAP pressure. Let's discuss the patient circuit details. The patient circuits and CPAP masks are used to connect adult or pediatric patients to any air-on ventilator CPAP system and may be used with an endotracheal tube or face mask with the angle connector provided. The patient circuit configuration for the MACS is a single-limb 22mm circuit with the expiratory valve. The MACS CPAP mask has a lip seal specifically designed for CPAP application and seals with low force, even over beards. We also offer patient circuits with non-invasive mask, head strap, and expiratory filters in one package. The patient circuit expiratory valve has been designed with an elbow to support the direct addition of the expiratory bacterial viral filter for the patient's expired gas. Simply adding this filter to the device will help you protect yourself, your team, and your patients. To enhance your clinical practice, the patient circuit allows for inline nebulization and CO2 monitoring requirements, placing the T between the mask and the circuit. Please note, only Aeron manufactured patient breathing circuits are approved for use with the Aeron MACS CPAP system. All Aeron circuits are identified with FDA-cleared labeling. MACS is calibrated specifically to the Aeron patient breathing circuit, and the use of any other patient circuit may cause CPAP and flow to be inaccurate, higher work of breathing during spontaneous breaths, higher expiratory flow resistance. Aeron's patient circuits are competitively priced. The use of unauthorized circuits increases your liability and may put patients at risk. One final step. Keep in mind, prior to clinical application of the Aeron MACS CPAP system, an operational verification procedure, or OVP, should be performed to validate the device's performance to specifications. The operational verification will measure the pressure delivery for accuracy during both 65 and 100% oxygen settings. For further information, please refer to the Operator's Manual, Section 4 for the MACS CPAP system. Now let's walk together through a simple MACS setup. With the MACS attached to a high-pressure oxygen hose on the rear panel, the clinical setup is accomplished in 3 quick and easy steps. Step 1. Attach the Aeron patient circuit to the MACS on the front panel, both the large bore hose and the smaller tubing. Step 2. Set the CPAP calibrated control for the level to meet patient needs as defined by your protocol. Step 3. Set the desired percent oxygen at either 100 or 65%. As noted, oxygen tank duration almost doubles with 65% oxygen setting. Now you are ready to start CPAP. Attach the other end of the high-pressure hose to the oxygen source and turn on the oxygen. Then, attach the patient breathing circuit to the patient using either a mask or endotracheal tube. Adjust the CPAP control as needed and monitor patient effort on the pressure gauge. If the patient is not attached to the circuit or there is a large leak from the mask, a high flow of gas will occur. Once the system is functioning with the patient connected, assess your patient according to your protocols for patient respiratory rate, comfort, oxygenation, and CO2 as appropriate. For an added measure of patient safety and your peace of mind, MACS has special built-in features, including an internal safety pressure release that limits circuit pressure to 40 centimeters of water, and in the event of a device malfunction, the anti-suffocation system's internal valve will allow ambient air to enter the patient circuit. EMS agencies are often looking for CPAP ventilator combinations. Aeron's MACS and Newton Model S ventilator are matched devices with the same CPAP oxygen controls using the same patient breathing circuits. Hospitals appreciate the use of sophisticated CPAP devices and ventilators over disposables with inconsistent function, high oxygen use, and no patient monitoring. Thank you for watching this tutorial on the Aeron MACS. Feel free to contact us with questions or to learn more about how Aeron can help you provide superior critical care respiratory support. Visit Aeron at aeronusa.com or call us at 321-821-9433.